implementation, and what do you do to address them if confirmed as Minister of Health?
Dr. Barasa, can you answer that?
Thank you, Honorable Deputy Speaker, for the question. For the primary gaps and challenges, my approach is a consultative approach. I believe that it is critical that we bring all stakeholders together. The Director General as well, the PSS, the National Technical Working Group. Participant in global strategies, global action plans, and also in the development of guidelines at a global level. In WHO, I worked for more than 4 years supporting various member states in strengthening their infection prevention and control programs. I supported them in matters policy advising, in strategic direction, and in technical advice. Implementing activities including development of guidelines, facility assessment, among others. My key achievements in the span of my medical practice include the strengthening of programs. At the beginning of COVID-19, we had only 4 programs within our 4 countries with infection prevention and control programs within the Eastern, South, and Africa region. And at this time, I'm proud to say that we have 22 countries within the Afro region which have strengthened their infection prevention and control programs. So I supported in matters of development of their strategic, their national action plans, and also in developing guidelines, facility assessment, monitoring and evaluation framework, among others. Equally, I supported in emergency response, in emergency preparedness, readiness, and response pillar.
That will do. I will now invite the Deputy Speaker to be the first to ask your question. When questions are asked, to expect precise and concise answers. Deputy Speaker.
Okay. Dr. Barasa, as you're aware, the health financing strategy of 2020 to 2030 notes that Kenya's health financing is inadequate, incomplete, and inconsistent, and poses a challenge to the establishment of a universal health coverage. And now, with the shift from NHIF to SHIF, the effectiveness of the transition is being debated by Kenyans. So what are the primary gaps and challenges that you perceive in the implementation, and what should you do to address them if confirmed as Minister of Health?
Dr. Barasa, can you answer that?
Thank you, Honorable Deputy Speaker, for the question. For the primary gaps and challenges, my approach is a consultative approach. I believe that it is critical that we bring all stakeholders together. The Director General as well, the PSS, the National Technical Working Group, stakeholders as well as other sectors, including Treasury. We also need to involve the community. It is imperative that the community is informed and that they are aware and they own the SHI. Without the community owning it, implementation will be difficult. And so we need to strengthen communication, receive feedback, and analyze. In the consultative process, we need to conduct a situational analysis to see the strengths, the weaknesses, opportunities, and threats for the implementation of the SHI, and come up with priority actions to intervene and support in a seamless way. So, as I said earlier, community ownership is critical. Equally, we need to strengthen the operations and the logistics. If we don't have enough financing for the SHI, then the implementation will not be seamless. Equally, we need to address the logistics challenges that may arise during that. One of the challenges that I have seen Kenyans talking about is the Linda Mama. And before coming even before you, honorable members, it was raised to me. And I believe that it is critical that we have a transition plan or a transition guideline to ensure that our mothers and our children can access care even during the transition process.
Thank you. Majority Leader.
Thank you, Honorable Speaker. CS nominee Debra, I see you have a very good experience from your professional background and having worked in the private sector in healthcare. And one of the issues that probably might have come to your attention is the ills that bedeviled the defunct NHIF. And the move by government, and I'm certain you may have taken keen interest on the Social Health Insurance Fund and the challenges that are there now with the Social Health Insurance Fund. One of the problems that we've had with the NHIF is collusion between staff at NHIF and private medical care providers, unfortunately including faith-based ones. And we have seen exposés in the media of very small private hospitals raking in millions, hundreds of millions from NHIF. I would want to hear what, having looked at Shif, which I'm certain you must have looked into, what are the measures you intend to put in place should you be approved? One, to curb the theft that has been witnessed in NHIF by both the public and private medical practitioners, especially owners of private hospitals. Two, how do you intend to leverage on technology to ensure, one, that you bring down the cost of healthcare in this country? There are hospitals that will charge NHIF 200 shillings for paracetamol. There are others within the same vicinity that will charge the same fund 30 to 50 shillings. How do you intend to utilize technology to curb some of those things?
You may proceed to answer.
Thank you, Honorable Member, for raising the concerns, and indeed, I understand and have interacted with various Kenyans that have raised the very same concern. First of all, my approach is a consultative approach involving the multiple stakeholders, from the PSS, Director General, the National Technical Working Groups, the NHIF, among others, including the community who are receiving the services. And with this, we need to conduct a situational analysis to understand the challenges, and from there, come up with interventions and action plans. But from an outside view and working in various organizations, I have seen the strength of having processes and procedures, of which I believe the government has, and we need to strengthen this. One of the ways is using a digital platform that will reduce the human-to-human interaction and will be able to monitor challenges. And this needs to be implemented first on a phased approach, but ultimately at a national level. And that way, we'll be able to monitor various services that have been given. We'll be able to monitor the quality. We'll also monitor the prices, the stockouts, etc. So I believe it's critical that we embrace the digital platform as Kenyans. Again, transparency and accountability frameworks are critical. So we need to look into this. And I believe that the National Technical Working Group is really competent, having interacted with them in the WHO environment, and I think we can work together with the multi-sectoral approach to ensure that we have transparency and accountability, open tenders, among others. We may also consider using external bodies to monitor and ensure that we have no challenges in that. And leveraging on technologies, I believe it's time that Kenyans embrace telemedicine and also embrace the digital platform as discussed earlier.
Junnet?
Thank you, Chairman. Chairman, my question to Dr. Debra is, Madam Nominee, as you are aware, health is majorly a devolved function. Health matters happen at the county level. But the problem this country has encountered for the last 10 years or so, since the new constitution and that devolved health functions, is because there is no seamless working system between the national government and the county government. It is devolved, but you'll see a lot of things are happening at the national level. All the complaints are at the national level, and these things are supposed to be at the devolved, because the dispensary at the village there is what matters. So how do you intend to make sure that health is really devolved and resources are taken to devolved units so that people can get the services at the road there, I mean at the village there? And my last question is, you can see health, the number of medical students also are increasing. And the number is becoming big. There are more health workers that are being trained, even as doctors. But the institutions that are training them now are becoming deplorable, in a very bad state. Do you think that will compromise the quality of healthcare or the quality of services Kenyans get? Thank you very much.
You may proceed to answer.
Through you, Honorable Chair, I would like to respond to the Honorable Member regarding the health, the devolved government. So again, a consultative approach. I believe we need to involve the national team as well as the county government to have open dialogue and come up with interventions. We need to look at the situational analysis and see where are the strengths, the weaknesses, opportunities, and threats. And from there, we need to come up with priority interventions. So I'm coming out of the government, but I believe having open dialogue, having consultations, and coming up to ensure we understand where the national team stops and where does the county begin. Another thing that will ensure seamless flow of information and also to ensure monitoring from national level down to facility level is the health information system, a digital platform, so that the reporting system is picked up and goes to the national level and also trickles down to the facility, as well as tracking and monitoring of infectious diseases, quality of services, and also addressing the matters of corruption. So again, it will be critical for us to embrace the digital platform in this case. Regarding the medical students, what I would say is the health workforce is a critical pillar in health systems. All our health workers are important. The doctors, the nurses, lab technicians, physiotherapists, nutritionists, among other cadres. And let's not forget the morticians and the cleaners who are frequently forgotten. And I think it's critical to say that during COVID-19, we saw that these cadres were actually disproportionately affected by COVID-19 and even other infections like tuberculosis and Ebola. And so we need to strengthen our health workforce. With the numbers increasing, I believe, again, it's a consultative effort. We need to bring unions on board. We need to bring professionals on board, the doctors on board, and come up with strategies and areas of improvement. We also need to strengthen our regulatory system to ensure that we are bringing out doctors and other health workers or professions who are qualified, because we are also thinking of these doctors or nurses and other professions working outside Kenya. So we need to ensure that we are providing quality, top-notch quality and highly experienced health workers that are able or capable to work in the in other international spaces.
Honorable Naisula.
Thank you, Chairman. Dr. Debra, my question is that the instances where doctors